everyone. In this video, we will learn about health information exchange. So with this lesson, the learning objectives are: we will identify the needs and benefits of health information exchange, otherwise known as HIE, and we will discuss about interoperability. What is the link with the health information exchange with the interoperability of the data? Then secondly, we'll discuss about healthcare data, which should be shared, and how the currently data is being shared and how it should be shared. Thirdly, we will highlight and list the HIE challenges and barriers. Then we will discuss about organizations such as HIUS and the roles of HIUS. And at the end, we will summarize our learning objectives. So starting with HIU, Health Information Organization. What is HIU? Do you have any idea, HIU, about if you have heard any word or written, or if you have any idea about HIU, just write on your paper and before reading this definition. After that, you can check your definition with this definition. With HIU, we define as an organization that oversees and governs the exchange of health-related information among organizations according to the nationally recognized standard. Now, if you recall the EHR chapter, we discussed the electronic data of a patient, which is stored in a nationally or internationally recognized standard, and their data is collected by some paramedics, like the licensed people. But we did not discuss that how this EHR of one hospital, hospital 1 and hospital 2 and hospital 3, how this data should share and would share across organization. Here it comes the roles of HIU. HIU basically is an organization. A third party could be an organization at federal level. It could be at a regional level. We will discuss later on about the different types of HIUs, and could be inside a hospital, a small office. And their job is to oversee and govern the exchange of health-related information among organizations according to the nationally recognized standard. What this means, this organization help hospital 1, hospital 2 and hospital 3 and several other organizations just like the CDC, FDA, to share and exchange information according to the nationally recognized standard. Right? Okay. Now, what are the potential functions of the HIU? One thing is, in general, we see like HIU helps in exchanging the information across organization. Now we are looking in specific, what are the potential functions of HIU? So the functions start from a result delivery. For example, at the EHR level, at the hospitals level, they have results about a patient or a number of patients, and if they would like to share, so that would be the result delivery. Then secondly is the connectivity, how each one, hospital 2, hospital 3 and others will connect with each other through which channel, through which special link, because it's the healthcare data. And here the security and privacy is very important, so we have to take care about about the medium when we exchange or share our data. Then HIU, another function is clinical documentation. Like there are several kind of the clinical documentation. What would be the one format, or the format which would be the which would be a universal or understandable to multiple organization involved, and then alerts to the clinicians. Different alerts could be, we see the in EHR module that there are several kind of alerts, and when it would be the alerts across organization. So the different kinds of alerts, that's the responsibility of the HIO to manage. Then electronic prescription, sharing it across organization, health summaries, uh, electronic referral processing and consultations, and credentialing, like looking for even the doctor's credentials, looking for the patient credentials, and all these are across organizations, as I mentioned, like among different hospitals, among different federal and regional agencies. Then at the end, some quality reporting, like how the specific measures are taking at certain hospitals, how the patient safety and quality are monitored in a certain setup, and distributions of these results. Also, if some hospital would like to host mean would like to install EHR system on the cloud, on a cloud softwares, so they also help to provide the hosting for that. They have the people who assist in data loading and unloading on the EHR. They also provide a different kind of the interface, like the web interface. It could be the a desktop interface or other interface for the EHR. Alerts, multiple types of alerts. Like we have the drug alerts, we have drug allergy alerts, drug food allergy alerts, billing alerts. And you see, like here, these alerts are not just based on the one hospital's, one clinic or one setup. For example, if they have some drug allergy alerts found in hospitals number 10, and so the HIO is responsible to spread these results among all the connected hospitals through the HIS hospital 10. In addition to that, HIO has the potential to link together segregated healthcare system, offices, lab into one entity. As I mentioned, like the hospital 1, hospital 2, hospital 3, CDC, FDA, and maybe the smaller clinics, entities like at the rural areas. So basically, they link them up logically through the internet, but using the nationally recognized standard through, so that if they share the data, that would be the understandable, which otherwise known as the interoperability. We discussed interoperability in our previous slides. Today we will also discuss about the interoperability and the types of the interoperability. Now there is a term used, the pull technology. This permit technology for the physician to search for a patient data. Basically, you know, they are when a doctor search for a patient information, right, and gets the patient info. For example, doctor sitting at the city like Connecticut, search the information about the patient at Cincinnati or maybe at Florida. They refer to as the pooling of information, and they call it like the full technology. A physician can search a patient and pull a discharge summary of a result from a variety of organizations. So the getting or fetching the data is like the pull technology, and you can get benefit of this pull technology if everything is interlinked. through a web interface or through secure channels. However, you see the implementations of technology is easy. Deployment of technology, there are challenges. You see, we last time we discussed the technical challenges. Securing and safeguarding of the information is one challenge. There are over 75 different kind of the vendors available. Selling EHR is a challenge. Several other challenges, but these challenges are manageable at this time. But bigger challenge is once you have this technology, training the staff, sustaining and continuing this deployed technology without federal support is a challenge. There are some organizations. I have listed one organization here. Those who were able to successfully sustain this deployment and the sharing of information without federal support, and we will see that how they have organized this or how they have managed this whole thing without the federal support. So some facts about the HIU. HIU office can be centralized or decentralized. Like centralized mean could be office could be at the federal level, right? And then it connect with the different states like New York, NJ, FL, right? And can be decentralized, maybe a network with the East Coast, West Coast, Midwest, right? And it could be there for the profit and for the non-profit. We have non-profit organizations, those who are helping to set up the HIUs, and some for profit organizations, those who provide the example is like the federal organization or some NGOs, and then for profit organization just like the EHR vendors, they also help us to set up this network and help in exchanging the information, but they charge. Can be government, private, and community based. Could be at regional level, at the hospitals level, at the regional level, and it could be at the federal level and even international level at this time. Some more facts about the HIUs. The last survey that was collected in 2013, there were about 200 HIUs in the US, but only minority are mature and successful. So as we discussed in our EHR class, there are different levels of the EHR maturity. We have around the 80%, 70 ranging from 70 till up to 90, and some around 95% hospital systems are having a EHR system, but not all are mature in terms of their meaningful use. Same as health information organizations, health information exchanging domain is not that mature. Many large hospitals, healthcare system have decided to create their mini HIOs. As I mentioned, like for example, the bigger setups, just like we have here Northwell Health and others, they have their mini offices. They have a team with a designated like and when with their uh, uh, with their um, with their designated with their purpose and with overall people with designations, and their job is to connect with the different hospitals and help them, assist them. For example, when hospital 7 asks to release a data of a certain patient with ID X12345, whatever they have the coding, so they look at that and cooperate with the hospital 7 to exchange and sharing the information. Now, there are many HIOs were started with early federal funds and that are no longer available, just like the EHR. This is the bigger issue that we see that deploying the technology or having the technology and initial level training, um, they mostly these organizations they have managed that. Now, at this time, the issue is to sustainability. HIO can charge subscription or transaction fee, but healthcare organization has have to see value to be willing to pay for this. If healthcare information exchange, for example, if 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 the hospital one asks to get data from the hospital 7 about a certain patient, one way of the sustainability, if they could charge this billing to a patient, then there are issues with the insurance, whether the insurance will agree with that or not. What would be the co-pay out pocket? So these are some challenges, and why the patients they will pay on top of their uh, other services. They are paying for the medications, they are paying for the prescriptions, and then again there would be a burden on the patient's shoulder. So these are things to some questions are the things to resolve. Third point is HIU can support meaningful use by the hospital service providers, and the meaningful use is still is a challenging at this level. Meaningful use, like how they what are the protocols and how they should share the information across different organizations, and what would be the value of their, what is the advantage and disadvantage of this. These things are still under review. There are some well-known run HIU in the countries, but there have been many failure and stagnations. As I said, the bigger issue is the dollar sustainability. There are some organization, just like the I'll give you the example of the health collaborative. They have managed successfully to continue without the federal support, but several a bigger number they have to close their this information exchange functions because of the financial issues. Now, the health collaborative, which was previously known as the Health Bridge, is a non-profit HIU serving in the Cincinnati area and some part of the Kentucky and Indiana, and was started in 1997. So this is one of the example of use case of the success use case, and they're quite successful to manage the finance with income not based on the federal grants but rather on monthly subscription fee. So they put the subscription fee. They ask for the patient to for the subscription fee if in future they would like to, or if they want to be their data to shared across different organizations. So the cost will be then shared by the hospitals plus patient plus insurance. HIO at THC provides information exchange for 50 hospitals and up to the 7,500 plus patient, physicians. It's a pretty big network. It provides access to the imaging, from the X-rays to the CT scans to the fetal heart monitoring to the hospital-based EHR. They are HISP and participate in direct project. We will see the HISP and the direct project in our last slides for what these are. Health information service provider, and direct project. We will see that how the direct project works. They also offer workflow redesign and disease registries, data analytics, a consultancy, reporting, whatever we see uh, the functionality of the HIUs. They almost provide everything, but they at the same times they have managed without the federal support. Even the readmission, duplicative radiology, then the opioid prescription, uh, they have managed by the THC. Okay, so now we have looked at the starting from the HIU, what is HIU, roles of the HIU, and some major issue like the sustainability, one successful example. Now we are moving towards the types of the HIUs. What are the types of the HIUs? Uh, as I mentioned at early, like we could have the HIU at the federal level and we could have the HIU at the regional level, and we define that regional health information organization, RHIU, is a health information organization that brings together healthcare stakeholders within a defined geographic area and governs health information exchange among them the purpose of improving healthcare in that community. Now, for example, if we take just East Coast, we have then the Boston, right? And what other major city we have, like the New York, um, just say like the other cities we can have, just like we can in Connecticut we can take the New Haven, right? So the Boston is connected with the New Haven, and then it's connected by the New York, right? So we can create this with all the hospitals. I mean, here we have, just say we have 100 hospitals, we have like 50 hospitals, we have just 150 hospitals, clinics, and a related organization. We can create the network of these hospitals, and we can refer to as regional hospitals, and then they can have their own in-house even HIUs, and these regional hospitals may be a cluster is connected with another cluster in the Midwest or in the West Coast. So this is how they work. Now, the concept of interoperability we discussed in our first class, in the second lecture, I guess, also interoperability. Uh, what is semantic and syntactic interoperability? I'm sure at this time you should have idea about the syntactic interoperability and semantic interoperability. Just write on the paper what you have. In general, interoperability is defined as the ability of two computer system exchanging the data between each other, right? So this implies their data is computable and the standard exists that permits the interoperability, right? So if you share the patient data from one EHR to another EHR, and if it is not in according to, just like if you share the data like in ICD uh, uh, like 9 format or 10 format, and this system should also able to interpret the ICD 9 or 10. Similarly, if you get the data from, just like from the Japan and from other countries where they have using different standards, you cannot open, interpret, or automatically link, analyze, consolidate the data if they are not sharing the same standard. And now, health information exchange, how the interoperability is linking with the health information exchange. So when we say the health information exchange, we are saying the electronic movement of health related information from among organization according to the nationally standard. Organization, hospital 1, hospital 2, hospital 3, FDA, CDC, NIH, right, different organizations. So moving of the data, sharing, exchanging, moving of the data from these organizations is called health information exchange, and that would only be possible if it would be according to the nationally recognized standard. Now, when we say the interoperability has a three different level. First level we say is a foundational level, second level is syntactic level, and third level is the semantic level. So the foundational level refers to any technology or platform used to exchange the data. The first level is the hardware level. Like at the basic level, what tool, what medium they use. Either they use like a fiber op, or they use some special network, or the technology, they are using a standard computer, Mac computers. They are using the just recall the technologies, the healthcare computing technology that we have discussed in chapter 2 in our second class. That these are the foundational levels, and then is the syntactic level, which means messaging have the structure and syntax that is understandable. For example, these are the names of the format: XML, extendable markup language, and HL7 health level 7. Right. So by the way, we have HCI 1002, which is the health standard, HCI 1015. These are two courses: HCI 1002, which we'll offering in uh, next spring. That is about the information flow, and HCI 1015 is about data standard, where we will study more about the ontologies, vocabularies, also the different standards from ICD to RX norm and other standards. So if you are interested, you can see those courses and register. Then the semantic level means terminologies and coding must be the same for the sending and receiving of the information among the organization. So the foundational level, syntactic level, and semantic level, these are the three levels of the interoperability. Okay. Now, exchanging or sharing of health information. Why we need that? We already have discussed. Let's discuss in brief with some examples. So sharing and exchanging of health information is vital for health care reform at the local, state, and national level. At the national level, it gives overall the national level health of the people, and all helps to manage or allocate the funds, and helps to manage the resources. At the same as with the state level, at the local level, at the hospital level, at the community level. If we electronic healthcare record doesn't if we don't share, then we have moved from paper silo to the information silo. What this means, that if we have the healthcare, we spend a lot of money digitizing our paper-based record. We have the paper-based record, spent a lot of money shifting into the electronic EHR, but we are not exchanging data with hospital 2, hospital 3 for data analysis, for uh, for all other purposes. Then we are basically not making it a better use. It's not the meaningful use level, or the quality of meaningful use level is low, and we are not using it in a way as we should use to. And it does then it means that we have just moved from paper silo to the electronic silo. So healthcare data potentially be shared. What could be what type of the data, healthcare data, that we could share? Let's look into it. Starting with the clinical results, just like we have different labs, different pathology labs, different allergies information, immunization information, some data about the microbiological, about the DNA gene analysis data. Then we have some data about the real images data, just like the radiology data, MRI and CT scans data. Document type of information or data, just like office note, discharge summary, emergency note, patient history. In general, continuity of care, how this document CCD describes that what was the patient condition and how the patient was treated, what's the current condition of the patient, what they are anticipating, what medications the patients are taking, and XML based document and standardize and summarize care. So that's the part of the clinical summaries. And financial information, claims data and eligibility check, medication data, electronic prescription, some formulary status and prescription history, and more. We have data about the performance, just quality measures like blood pressures level, diabetic level, cholesterol levels of all the patients, or one patient, or cohorts, case management information, public health data about immunizations to infectious diseases to the outbreak, and if they have any referral management information. So such kind of data, and these are the main examples. We can have the other kind of the data to share among different organizations based on their need. All right. Now look at the nation. Let's look at the Nation Healthcare Information Network. This is, you can see, a federal level HIU. The US federal government had the vision to create a nationwide sharing health information. They have started with a patient who travels often, just like the military people and people involved with the different government agencies, where they have often move from one place to another place, and often and frequently move. So NWHIN, HIN, is not a specific network, instead of a set of policies and standard. So here what they mean, it's not the network in a way that it's not a physical network, like connected with a physical special system, like they have the special wire, or they have the special network. No, rather they follow a set standard. They follow policies, they follow a certain standard to share information, guidelines. So NWHIN has a select number of members, Army and other mainly federal agencies who exchange some information, but there has been a limited growth. If we look at the schema, like schema mean the architecture, that how this NWHIN looks like. So you can see here we have different organization. This is the community one, community second. See, in the community one we have pharmacy, we have doctor hospitals, we have some labs, and then the same with the community two. Then we have a Department of Defense, different federal level, VA, IHS, CDC, and a different organization. And you see this red thing here. Let me change the color for you to be more visible. This red, this is basically an internet, and then these dotted lines are the standard. So what this mean? This mean NWHIN members exchange information through internet and with the help of the standard specification and agreement for the secure connections that they have. Right? Okay. Now, some facts about the NWHIN. The reality is that health information exchange is expensive to create and maintain, and interest in national sharing is limited. This is based on the initial data that they have released. That the overall the result that they have achieved, they say like it's costly. For that reason, federal government funded a state level HIU programs and HIU and HEE programs. They also created a secure email message instead of just going with the following all the standards, rules, vocabularies, and having to build a special separate softwares. They would like the organization to start with a very simple. For example, they say, okay, we could share and exchange the health information through an email, or they have upgraded from fax to an email. But the email, there would be some standard, there would be some format to follow with when they share exchange email information. In 2012, NWHN was renamed eHealth Exchange, and uh, later on the same year, they have renamed this project to a Sequa project. The details that you guys can go over there and go to their about section. They have several use cases over there. They also have explained about the history and more information that we have discussed over here, like the purpose, why they have started that, where they stand now, and what is their long-term vision. So eHealth Exchange group of a federal and private organization, and they share the data. Trust framework to connect the current and future healthcare data sharing. They branded it Care Quality. And the organization, just like a Radiology Society of North America, RISNA, share test vendor compliance and exchange of images. So RISNA, like organizations, they are connected with them to sharing and exchanging of the data among different organizations. More details you can find from this website. Now let's look at another very important project. It's called the Direct project. With the Direct project, with the slow adoption, the issue that they had at beginning, one is was costly. Second, the adoption, the people, they feel that, as you see in case of the EHR, training the staff was very difficult. But at least people, they would able to share and exchange the messages or email information even with the older staff. So with the slow adoption of EHI nationwide, so they come up with an alternate and they gave it the name of the Direct project. With this project, they have very few things. For example, they have the email between the clinicians, patients, hospital, and consultant. And so the project requires all parties to apply a register for a unique email. This email address is basically monitored by just like it's not, you can send email from a Gmail or random ISP. You have to send email through their secure channel, and email should be in a specific format. And this project is administered by multiple health information service provider, or HISP, or health information service provider. And this is also linked with the push technology. You can read more about the Direct project, what is Direct project is, from this link. Now this is the schema, again the architecture about the Direct project. So for example, this is a paramedic and it would like to send some information to this person. So he will write the message and send the message to the push the message, and this message will not directly go to that. Rather, this will go to the HISP, because then the HISP will check that whether the message is according to their standard. Then they will look at whether receiving person is in their directory, and look for the other protocols that they have. And after that, it will send to the receiving person party, and this is the exchange of the receiving person, and then message will be delivered. So in other words, this is a simple email and message exchanging, but in a very secure way and in a very according to the some nationally or agreed standard of the information. So they feel that this is much better and easier way through which the people can start the health information exchange, and that would replicate fast. So this is an example of the email address like direct.aclinic.org. The goal will be the EHR vendors to include this mechanism with their email system, and the continuity of care document will be standardized to be summarized care. Now, the idea is just to simplify this whole healthcare information exchange project, at the same time keeping this information secure and safe. Even that, it's very hard to gauge the success of this program, that how this project was successful. This is still under observation, or still, they are figuring out. Another project is the Blue Button project. Another avenue to allow healthcare data sharing is to allow patient to download on the patient side. Now, this we looked at direct project on the healthcare provider sides, right? Now, as a patient, if you would like to download the data, or the doctors would like to send the data and you would like to download some data, then there is a Blue Button. This approach was taken by the VA, Veteran Affairs, and other healthcare organizations. Blue Button Plus project will use data standards such as CCD standard, continuity of care document standard, to download and can be printed, shared, assist meaningful use of the requirement. So basically, Blue Button project was to assist to the patient, and also this is exchanging of the data, and this is just downloading of the secure data of the information is a Blue Button project. And with that, they try to now have they set some meaningful use so that the people involved can maximum get benefit out of this technology. For example, health information and stage 2 meaningful use, like they have two stages, stage 2 and stage 3 meaningful use. So the stage 2, at least they say, provide patient the ability to view online, download and transmit their health information within 4 business days. They share information, and with that, patient would able to information with the defined period of time. Secondly, provide patients the ability to view, download and transmit information about the hospital admission. Thirdly, they provide clinical summary to patients. You see here, this Blue Button project is specifying or designed for the patient. This was designed for exchanging information among the different parties of paramedics. Then capability to identify report cancer cases, public health central cancers, and these are a few examples. Capability to identify report specific cases to be specified registry. Some more example: capability to submit electronic portable lab result, capability to submit some syndromic information, record whether patient 66 years older and have adverse directives, some secure messaging, some imaging exchanging ability. So that is the at stage 2. At stage 3 level, they have some advanced level feature, and they even have rebranded that as a project is called MACRA, Medicare Access and CHIP Reauthorization Act in 2015. And so at the stage 3 level use case and beyond, they follow the MACRA or MACRA Act guidelines. For you can look at the MACRA and meaningful use here by clicking on this link, and it will provide you the information that how this stage 3, and Emacra is a different or kind of the extended version of the stage 2. Another project they have at the end is state-wide health information exchange cooperative agreement program, and otherwise known as SHICAP or SHIECAP. The High Tech Act established like in 2009. We know that in the last lectures we discussed. High Tech Act established funding the HIA, Health Information Exchange, within the across state lines, like within the state line if they have different hospitals. So with this project, they support and help them technically, financially. Most stages begin in 2010 with the federal funding in 2009. Once again, the goal is to align the national health IT policy and support meaningful use. You see, the main issue is the adaptability. The people, they even have the system, even have the network, all the components available, but like to make them maximum use, that's the one of the challenge. State organizations were supposed to fill gaps in sharing and fully embrace and possibly host direct project messaging. They were started that, and they were helping in exchanging that information. This project was ended in 2011. Why it was ended, and currently what the ONC, the Office of Federal Office of Health IT, what they are currently doing, you can get this detail from this link. Now let's look at the barrier. At this time, we see the barrier of EHR, health information, health electronic health record. Some barriers to the HIE are similar to that. For example, but some are different. For example, the HIE barrier, health information exchange barrier, why it fails. One is a lack of successful business model. We just see the example of Cincinnati, and there are several other at this time, but we don't see the successful example who are running their setup with a federal support. Environment is highly competitive. Hospitals and clinical setups, they are running after like the medical procedures. They are racing in making money and improving and going towards more like the diagnosis and other gadgets, and so it's very competitive environment. If they can go for the health information exchange, they consider that it's a secondary, it's not primary. So federal support monies are gone. So the federal programs they have started at this time, there is no active program. HIUS seems to be work better in a population area, just like it could work in a New York or other areas where they have more people, and where the people just like in the Utah and the other people, they have a less population. It would be very hard for cost sharing for the people. And for the investor point of view, the return on investment is not clear. Also, same time, proof of benefit is weak, and privacy and security issues. So these are some barriers, challenges, and at the same time opportunities. If we could handle, then definitely we could improve that. Now, what are the newer HIUS model? At this time, we see the technology like blockchain, which technology for use for the bitcoins and but the technology behind it is a distributed transaction ledger, that how to exchange the information from one point to another and to the other very safely. So adopting this blockchain technology for health information exchange and EHR would be a game changer. Open EHI, some system at this time, if the vendors are available, but at the same time, the system which are open and free to use that, maybe using that system and customizing that systems, and not to buying the proprietary system would be a solution. EHR vendor-based HI vendors such as Epic have options to share physicians not in network, and with those, why are not using their EHR product just like the care everywhere? So some vendors, as we discussed, there are several vendors. So just like the Epic is very famous and big vendors that have the EHR system, and in their complete EHR system, they have the modules of sharing of information among different EHR system deployed in other systems. So, but the purchasing and having that system, just like the Epic, is also costly and probably is not affordable for the smaller networks. So to conclude, we can say one of the major requirements for successful health reform is health information exchange. However, sharing of healthcare information between clinics and patient, they have to be according to a nationally confirmed standard. The meaningful use requirement will promote HI with tools such as patient portals and secure messaging. And however, our highly competitive and fragmented healthcare systems has made sharing of information from the segregated organization quite difficult. All right, so that's all from this lecture.